I ask all of our guests to please take their seats. Subcommittee on Oversight and Investigations will now come to order. The chair recognizes himself for a 5-minute opening statement. Today's hearing is about what likely is the most consequential cyber attack in healthcare history. How could something like this happen? How did consolidation in the health insurance industry reach such a state that a single ransomware attack on one company can cripple the flow of payments and claims for months? Change Healthcare, a United Health subsidiary acquired in 2022, was subject to the cybersecurity attack. It operates the largest electronic data interchange clearinghouse in the nation. Roughly 50% of U.S. medical claims pass through or touch Change's clearinghouse, making it an essential link between providers and insurers. A single company having this much of the medical claims processing market, the market share makes them a large target for bad actors. It is even more astounding when you consider that the attack itself reportedly occurred using compromised credentials without multi-factor authentication. This type of authentication is pretty standard defense to prevent cyber attacks. I'm concerned also about patients who have been affected. Many patients were left having to pay large amounts of money out of pocket for their medications because the pharmacy couldn't process their claims or their copay coupons. The Marion Family Pharmacy in Marion, Virginia, in my district, said the biggest effect has been patients not being able to afford their medication without copay assistance cards. The owner of the pharmacy even said, and I quote, "We've got people walking away from diabetes medicines, antipsychotics, and ADHD medications," end quote. One specific example was a patient having to pay $1,100 for medication since the pharmacy was not able to process her copay assistance card due to the cyber attack. United is contractually obligated to pay for these medications, yet patients are still paying premiums and forced to either walk away, pay large sums of money for their medications, or even having to borrow money from friends, family, or worse, interest-bearing cash advances off of their credit cards. Providers were also deeply affected by this cyber attack. In the initial phase, providers were left in the dark as to why United stopped processing claims. There was deep uncertainty about how to get their claims to flow uninterrupted. The loan program was minimal and restrictive, while bringing on many unrecognized expenses for the providers, such as switching clearinghouses and managing prior authorization. It's particularly troublesome also because doctors are worried about keeping their practices open. United, by shutting down its clearinghouse and effectively stopping all payments on claims, making it more difficult to continue providing services. One suburban Philadelphia physician who runs a $6 million a year practice was offered only $3,300 by United Health's emergency loan program. She might have to sell her practice. How many millions of dollars of interest alone has United made from holding on to money that it would have had to pay to providers or for patients? How many millions of surgeries, treatments, and prescriptions were delayed? Or worse yet, were either canceled or they just didn't take their medicine? I understand the substantial task United is facing while dealing with the fallout from the cyber attack, and the cyber attackers are the bad guys. But I look for an explanation on why United didn't have a backup plan. And if they did have one, it obviously failed, resulting in the federal government having to step in and try to help. Additionally, we do not know how many patients had their health information breached. Last week, United conceded that a personal health care information and data of a substantial, quote, substantial portion of Americans has been stolen. At this hearing, I hope we can get an understanding of just how many Americans fall within United's definition of substantial proportion. Even though United paid the ransom, we now have reports that cyber criminals are releasing patient information, billing records, and other personal and sometimes very private health data held by United Health Group onto the dark web in spite of having paid the ransom. It's what happens when you deal with thieves. I'm hopeful this hearing will shed light on these issues so we can understand the full picture. I can assure you that this subcommittee We'll be watching closely, and I'm always willing to hold follow-up hearings if needed. All right, that being said, I yield back and now recognize the ranking member of the subcommittee, Ms. Castor, for her 5-minute opening statement.
Well, thank you, Mr. Chairman. Cyber attacks have become an unfortunate part of our daily lives, and companies know that they need to be prepared. We're so interconnected online now. Communications, energy grids, online platforms, and health claims clearinghouses like Change Healthcare. They're all targets. Ransomware groups and other threat actors are constantly probing corporate and government systems for vulnerabilities. There are reports of major data breaches almost every week, sometimes due to malfeasance, sometimes by sophisticated cyber hackers. But despite all of the cautionary warnings, the largest health insurance company in the country was caught totally unprepared. Change Healthcare, which is part of the mega health conglomerate, United Healthcare, did not have basic cybersecurity protections in place. Because of that, it suffered a ransomware attack and was unable to recover its systems in a reasonable period of time, leading to serious harm to doctors, to providers, to pharmacies, and patients across America. Even with the limited information that has been made public, it is clear that there were multiple system failures. First, United Healthcare was not using multi-factor authentication on a remote desktop application, Citrix. Multi-factor authentication is a very basic yet effective security measure that everyday Americans have implemented on their mobile devices, bank accounts, and email logins. In fact, the Department of Health and Human Services has recommended the practice since 2022 through its publication, Cybersecurity Practices for Medium and Large Healthcare Organizations, and specifically called out the importance of multi-factor authentication in a June 2023 newsletter. In that advisory, HHS noted that multi-factor authentication and other authentication processes stronger than a single password were necessary when an entity provided remote access. United Healthcare ignored that advice. Second, it appears that hackers freely roam through Change Healthcare systems for a week without being detected. There are essential network cybersecurity monitoring features that might have picked up and flagged unusual user activity, but that apparently did not happen here. Third, whatever user credentials the hackers had access to appear to have allowed them to roam across the entire Change Healthcare system unimpeded. And fourth, the hackers were able to deploy a ransomware attack within the Change Healthcare network, suggesting a lack of adequate controls or user permissions that could have prevented malicious software from holding their system and valuable health data ransom. And fifth, there appears to be a lack of any continuity or contingency plan to address this crisis. As your testimony states, Mr. Whitty, lots of time and resources were spent completely rebuilding your network. Yet it is unclear why there was not a reliable backup or a continuity plan in place that would have both prevented the need for a complete network reconstruction and dramatically reduced the amount of time for transactions to begin moving again. At each of these points, United Health Group failed, whether it was a failure to properly invest in cybersecurity or a lack of adequate oversight and accountability within the company. It's an open question, but the bottom line is that there were multiple opportunities to prevent, detect, and mitigate this attack, and United Health Group failed at every single one. In case any other companies, particularly health companies, are asleep at the wheel when it comes to cybersecurity, this is yet another wake-up call. Cyber threats are pervasive and worsening. Ransomware attacks can hold hostage the most sensitive of personal data, and profits from paid ransoms only strengthen and encourage ransomware groups to grow and carry out more attacks. There are no longer exceptional events. They are constant and must be properly prepared for. While there are lessons to be learned, I want to make clear that this crisis is not over yet by any means. There are pharmacies and providers that have not been able to reconnect to Change Healthcare's systems. There's a massive amount of personal health information out there that needs to be accounted for. And in addition to the questions you will receive today, there are numerous questions outstanding from this committee in a bipartisan letter that we sent to you on April 15th. So we look forward to the answers to those questions in a prompt manner. And I want to thank Chairman Griffith for putting on this important hearing, and I yield back my time.
Gentlelady yields back. Now recognize the chairwoman of the full committee, Ms. McMorris Rodgers, for her 5 minutes of questions.
Thank you, Mr. Whitty, for agreeing to testify before us today. Like Chair Griffith, I was disappointed that your organization declined our original invitation to testify on the cyber attack on Change Healthcare, one of your subsidiary companies before, and we had invited you to testify in front of the Health Subcommittee, but appreciate your cooperation in being here today. Most Americans have likely never heard of Change Healthcare, despite how crucial its functioning is to ensuring their access to care. Change acts as a clearinghouse for 15 billion medical claims each year. That means more than 50%, or right at 50% of all claims, pass through Change. That covers everything from routine checkups with primary care physicians to life-saving cancer treatments with specialists. Things that we, until recent weeks, took for granted. In 2022, your company acquired Change Healthcare as a part of the growing creep into every corner of our healthcare system. Under the United Health Group umbrella resides a health insurance company with more than 40 million covered lives across Medicare, Medicaid, and commercial markets, a PBM that managed $159 billion in drug spending last year, a provider group that owns roughly 1 in every 12 doctors in the United States, a bank that makes payday loans to providers. And that's just a few of the ventures under your purview. I say this to emphasize the massive responsibility that comes with your position, Mr. Whitty. With a family of 4 that's being crushed by inflation, you think that they're forking over more than $20,000 per year for their health insurance. When a senior citizen sees the AARP brand on your Medicare product, when a taxpayer funnels tens of billions in subsidies to your company, there's a reasonable expectation that they will get a baseline level of value for their hard-earned money. But I'll set the bar higher. You have a responsibility to protect the data of the people who have put their trust in you. Or more bluntly, in this case, you failed. On February 21st of this year, Change Healthcare announced it was hit with a cyber attack, severely disrupting the healthcare ecosystems for providers, payers, and patients. It's been more than 2 months since this cyber attack, and according to your own company's website, Change has yet to fully restore its services, and many negative impacts for our healthcare system persist. As your written testimony lays out, criminal hackers gained access to Change Healthcare through compromised credentials, so they were remotely accessing the company's portal 9 days before your company announced publicly the ransomware attack. This portal did not have multi-factor authentication enabled, a relatively basic protection against cyber attacks, which allowed the cyber criminals to unlock the door and break into your systems. Multi-factor authentication would be a basic expectation for a company handling the breadth of sensitive information that Change Healthcare does. It's now been reported that your company paid a ransom to cyber criminals. While I have grave concerns with the precedent you created by rewarding the criminals, I would understand that it would be a difficult decision to weigh that against protecting Americans' data. But here's the problem. It didn't stop the data leak. Americans' personal and private health information is on the dark web. This is private health data that you were responsible for protecting. Mr. Whitty, I suspect that decision will be a case study in crisis mismanagement for decades to come. I would be remiss if I didn't note that providers, especially small providers and solo practitioners, continue to provide uncompensated care as submitted claims cannot be processed through payers. It's been reported that some providers are contemplating closing, and others have been forced to rely on volunteers to care for patients. Others have had to furlough staff so their employees can apply for unemployment benefits. I look forward to hearing how this is going to be fixed as soon as possible. I'll note in closing that we're here today to learn more about what happened in the lead up and during the attack, and what you, Mr. Witte, are doing to fix it and prevent it from happening again. The American people, especially the millions who rely upon changes, services, and those whose information was leaked, deserve answers. I yield back.
Gentlelady yields back. Now recognize the ranking member of the full committee, Mr. Pallone, for his 5-minute opening statement.
Thank you, Mr. Chairman. We're here because the cyber attack on United Health Group's Change Healthcare resulted in a prolonged disruption to our healthcare system earlier this year, and the cyber attack has caused serious harm to patients, providers, and pharmacies. Change Healthcare's platforms are reportedly involved with 1 of every 3 patient records, processing 15 billion transactions every year. And as a result of this attack, healthcare providers have suffered tremendous delays in reimbursement. Patients have also been forced to either front out-of-pocket expenses for their medicine or to delay treatment because pharmacies have been unable to process claims. Now, after Change Healthcare systems were taken offline on February 21st, United Health Group failed to provide clarity as to when its systems would be online again. In fact, United Health status updates repeated the same language for over a week, that the disruption was, and I quote, expected to last at least through the day. And this frustrated the ability of providers and pharmacies to conduct their day-to-day operations and decide whether to use alternative systems in the meantime. Now, over 2 months later, the system is still not completely back to where it was, and there is a backlog of claims that need to be submitted and processed. The delayed restoration and lack of communication from United Health Group about a central part of our healthcare system is unacceptable. We would not accept a bank or internet service suddenly being offline for weeks or months without a clear end in sight. And it's wrong that healthcare providers, pharmacies, and patients continue to bear the brunt of a failure by a corporation that earned $371 billion last year to either prevent or quickly remedy the situation. Now, I'm sure that we will be hearing from Mr. Witte about all the various things that United Health has done since the cyber attack to help providers, patients, and other payers. The bottom line is that United Health's data security practices were woefully inadequate. The company also did not have a plan in place to quickly recover from such an attack and to minimize the damage to everyone impacted. While it's true that the largest healthcare company in the country has since dedicated resources to clean up its mess, it feels like too little too late for all those who have been harmed. And to make matters worse, we still do not know the full extent of the damage from the cyber attack. Even if all the providers, pharmacies, and patients were made whole and the system returns to normal, huge volumes of protected health information appear to be in the hands of hackers. As United Health announced last week, this data breach could affect the privacy, and I quote, of a substantial portion of people in America. As part of our work in comprehensive federal consumer data privacy and security legislation, the committee has held numerous hearings highlighting the importance of companies adopting strong privacy and data security protections. So it's extremely frustrating to have one of the largest companies in the world failing to meet its obligations under existing law to adequately protect some of our most sensitive personal information. We're talking about sensitive information like our healthcare status, what medications we take, and what medical services that were provided. Now, Mr. Witte, this never should have happened, and it can't happen again. United Health Group must do the hard work of adopting strong data security practices that include protecting against such attacks and adopting plans that minimize the impact of such attacks. It's going to take a lot of work to untangle this mess. The Department of Health and Human Services and the Centers for Medicare and Medicaid Services have worked very hard throughout this crisis to minimize the damage to essential health programs. HHS's Office for Civil Rights also has a lot of work ahead as it examines what went wrong here and the harm caused by the theft and potential release of HIPAA-protected data. So, bottom line is, as we learn more about what went wrong, this committee should examine whether additional guardrails, such as establishing cybersecurity requirements on Medicare contractors, whether they need to be in place to prevent this from happening again. And this hearing is a good start. I want to thank the chair, both Chair Rodgers and Griffin, for holding it, and I look forward to working with my colleagues on the issues raising here, and importantly, hearing from Mr. Whitty about how to make sure this does not happen again. So thank you, Mr. Chairman. I yield back.
Gentleman yields back. That concludes member opening statements. The chair reminds members that pursuant to committee rules, all members' written opening statements will be made a part of the record, but we do ask that you provide those opening statements to the clerk promptly. We want to thank our witness for being here today and taking the time to testify before this subcommittee. We would also acknowledge that you were wise in choosing to first practice with the practice squad over on the Senate side today. I know you must be tired, but welcome to the A-team here at the Oversight and Investigation Subcommittee of Energy and Commerce. You will have an opportunity to give an opening statement followed by a round of questions from the members. And our witness today is Sir Andrew Whitty, Chief Executive Officer of United Health Group. We appreciate you being here, and I look forward to hearing from you. You are aware the subcommittee is holding an oversight hearing, and when doing so, we have the practice of taking the testimony under oath or affirmation. Do you have any objection to testifying under oath or affirmation?
No, I don't, sir.
And you're also, and seeing no objection and hearing no objection, we'll proceed. I also would advise you, you're entitled to be advised by counsel pursuant to House rules. Do you desire to be advised by counsel during your testimony today?
No, sir.
Okay. Seeing none, if you would please rise and raise your right hand. Do you promise or affirm to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Witnesses has responded in the affirmative, and seeing that he has done so, you are now sworn in and under oath, subject to penalties set forth in Title 18, Section 1001 of the United States Code. With that, we will now recognize Mr. Whitty for 5 minutes for an opening statement.
Thank you. Good afternoon, Chairman Griffith, Chairwoman McMorris, Rodgers, Ranking Member Castor, Ranking Member Pallone. Thank you for the opportunity to testify here today. My name is Andrew Whitty. I serve as Chief Executive Officer of United Health Group. Our mission is to help people live healthier lives and help make the health system work better for everyone. We pursue this mission through our two distinct businesses, United Healthcare, which provides a full range of health benefits, and Optum, which brings together care delivery, pharmacy services, and technology and data to advance patient-centered care. Change Healthcare is now part of Optum. It enables information, claims, and payments to flow quickly and accurately between physicians, pharmacists, health plans, and governments. I appreciate the committee's interest in the recent cyber attack on Change Healthcare. As a result of this malicious cyber attack, patients and providers have experienced disruptions, and people are worried about their private health data. To all those impacted, let me be very clear. I am deeply, deeply sorry. Our response to this attack has been grounded in three principles: to secure the systems, to ensure patient access to care and medication, and to assist providers with their financial needs. We've deployed the full resources of United Health Group in this effort, and I want to assure the American public we will not rest, and I will not rest, until we fix this. Cyber experts continue to investigate the incident. While we will learn more and our understanding may change, here's what I can share today. Cyber criminals entered a Change Healthcare portal, exfiltrated data, and on February 21, deployed ransomware. The portal they accessed was not protected by multi-factor authentication. Our response was swift and forceful. To contain infection, we immediately severed connectivity and secured the perimeter of the attack to prevent malware from spreading. It worked, and there has been no evidence of spread beyond Change Healthcare. Within hours of the ransomware launch, we contacted the FBI, and we continue to share information with them so that these criminals can be brought to justice. As we have responded to this attack, including dealing with the demand for ransom, my overarching priority has been to do everything possible to try and protect people's personal health information. The decision to pay a ransom was mine. This was one of the hardest decisions I've ever had to make, and I wouldn't wish it on anyone. As you know, we found files in the exfiltrated data containing protected health information and personally identifiable information, which could cover a substantial proportion of people in America. So far, we have not seen evidence that materials such as doctor's charts or full medical histories were exfiltrated. It will take several months before enough information will be available to identify and notify impacted customers and individuals, partly because the files containing that data were compromised in the attack. Rather than waiting to complete this review, we're providing free credit monitoring and identity theft protections for 2 years, along with a dedicated call center staffed by clinicians to provide support services. Anyone concerned that their data may have been impacted should visit changecybersupport.com for more information. Meanwhile, we continue to make substantial progress in restoring Change Healthcare services. First, the team built a new technology environment in weeks. Second, we prioritized our restoration effort on services most vital to ensuring access to care, pharmacy services, claims, and payments to providers. And third, while these efforts were underway, we worked quickly to provide financial assistance to providers who need it. We have advanced more than $6.5 billion in accelerated payments and no interest, no fee loans to thousands of providers. Most of these funds are for claims for non-United Healthcare plans, and about 34% of loans have gone to safety net hospitals and federally qualified health centers. We will provide this assistance for as long as it takes to get providers' claims and payments flowing at pre-incident levels. If there are providers in your districts who need help, please put us in touch with them. Fighting cybercrime is an enormous task and one that requires us all, industry, law enforcement, and policymakers, to come together. I look forward to answering your questions today.
Thank you for your testimony. We'll now move into questions, to the question and answer portion of the hearing, and I will begin the questioning and recognize myself for 5 minutes. Substantial proportion of the American population, what does that mean? How much? Are we talking 20%? Are we talking 50%? Are we talking 70%? Tell us.
Chairman, we continue to investigate the amount of data involved here. We do think it's going to be substantial. Because we haven't completed the process, I'm hesitant to be overly precise on that and be wrong in the future. I wouldn't like to mislead anybody in that regard.
Well, and I wouldn't want you to mislead us either, but when you say substantially, at least give me some kind of a range. You can be on the bottom to high. I don't mind giving you a range. Are we talking 20 to 50 or?
I think maybe a third or somewhere of that level.
Okay, all right. And I appreciate you letting us know that that's a suspect number, because the worst thing you can do is come in here and tell us something that sounds like it's a fact you're giving us and then have it be different. So I do appreciate that. Your company is contractually obligated to pay for your beneficiary services and medicines, and you're still collecting premium dollars and collecting interest on that money. And you heard me say in my opening, I'm concerned about the float issues. Particularly, while I am concerned about providers, I'm particularly concerned about that report of the lady who had to spend $1,100 out of pocket. And so you understand, in my district, that, and I don't know anything about this lady's circumstances because that's private information, but the average take-home pay in my district is $50,037. So $1,100 is a big amount of money, and even people who make more than that don't generally keep $1,100 laying around. So what are you all going to do to try to make those people whole?
Chairman, thank you very much for the question. On the first part of your question concerning the ongoing payment versus premiums that we collect, I want to assure you we've lifted all claim holds, and we for weeks have been paying claims as soon as they arrive at the company. So we are passing through payments in a very accelerated format. We know not everybody in the marketplace is doing that, but we certainly are. As far as the situation of the lady you described, first of all, let me say how sorry I am to hear of a situation like that. And I'm aware that there are clearly people who've had those situations, and
probably thousands of them that we don't know about.
I'm very sorry about that. Now, in these particular situations, two things I'd like to reassure you of. First of all, those systems are now back online. So in terms of those coupons and those card systems, they are back online. We have and will continue to honor in any prescription fulfillment where somebody was out of pocket in good faith. So we will absolutely honor that out-of-pocket cost. If for some reason the lack of service provision led to the out-of-pocket cost, And if there's anything further we can do for that individual, if your offices would like to connect us up, we'd be happy to help further.
And they would have to contact us for us to be able to do that and
course.
fill out the proper privacy forms, because we don't want to be guilty of giving away secrets either. But are they going to have to fill out a lot of forms? Because a lot of folks, you know, particularly if it's not $1,100, but it's $110, if you give them a lot of paperwork to do, they're just going to say, forget it, or choicer words.
No, and again, thank you for the follow-up question. No, we're trying to make this as administratively easy as possible, and certainly as far as pharmacists are concerned, where oftentimes this situation lands with the pharmacist having made that decision to fulfill the prescription without certainty that it would be reimbursed, we are honoring those in good faith without any further
And I look forward to working with you on that, because we want to solve this for all Americans, and so I look forward to working with you and your company on that. I have another question that I want to get to, and it's one of those things, it may be an unintended consequence, but I think it is a consequence. Medical practices. What we're hearing is that a lot of practices that, particularly in rural or urban areas, in underserved areas anyway, that your company is willing to buy the practice, which I think is good on its face. But as you heard Chairwoman Rodgers say, 1 in 12 physicians or doctors currently works for one of your subsidiaries already, and this is actually giving you all a leg up on buying other practices. How many other clinics do you think that were hurt by this cyber attack that have you acquired, and how many are you looking at acquiring?
Mr. Chairman, thank you very much for the question. Maybe I could just make a couple of comments here. First of all, we actually employ around just under 10,000 physicians in our Optum practices across the country. I know oftentimes people talk about a much larger number. That includes those who choose to contract and affiliate with us. So I just want to make sure that that's clear. Secondly, since this attack has taken place, we have indeed concluded the acquisition of one practice in Oregon. I want to reassure you in that situation, that was a transaction which was negotiated before this
Prior
event,
to that, I am aware of that.
and we
My
honored
time's running out. Any other practices that you all are about to acquire?
no, not at all.
That's what I needed to know. My time is up. I yield back and now recognize Ms. Castor, ranking member of the subcommittee, for her 5 minutes of questioning.
Well, thank you, Mr. Chairman. Mr. Whitty, one of the most concerning aspects of this cyber attack is how unprepared United Health Group seems to have been prior to February. Your testimony states that you are perpetually bombarded with attempted intrusions, roughly 1 per minute. And Change Healthcare's May 2022 annual SEC filing contains extensive disclosures about the risks of a cyber attack and all the processes it has in place to mitigate the risk. That filing specifically stated, quote, as our employees and business partners, employees work from home and access our system remotely, we may be subject to heightened security privacy risk, including the risk of cyber attacks and privacy incidents. You were clearly on notice that your company's networks were a regular target for attacks, and that remote access in particular was potentially vulnerable. With that being the case, why is it that one of your remote access applications did not have something as basic as multi-factor authentication enabled? And is it the case that it was never enabled or just not enabled at the time of the cyber attack?
Congresswoman, thank you very much for the question. We're continuing to investigate as to exactly why MFA was not on that particular service. It clearly was not. I can tell you I'm as frustrated as you are about that, having discovered that, and as we've gone back and figured out how this situation occurred. Change Healthcare came into the organization toward the end of 2022 after the timing of the declarations you just described, and Change Healthcare was a relatively older company with older technologies, which we had been working to upgrade since the acquisition. For some reason, which we continue to investigate, this particular server did not have MFA on it.
So it's not clear today. When will you be able to understand and give the committee information on why it was not activated?
I hope it will not be too much longer. Those investigations have obviously been going on over the last several weeks. It's all part of trying to figure out exactly what happened and making sure we learn any lessons, and also if there were any things there that should have been done that were not.
And who is responsible for that?
For the
Or ultimately, who was responsible on whether multi-factor authentication was activated or wasn't activated?
So company policy is to have multi-factor authentication on externally facing systems. In certain situations where you might have, for example, older technologies which have been upgraded, you may have security controls around those systems as a compensatory factor. That whole framework is clearly something we ascribe to.
But who in the organization is responsible, would be responsible for whether or not that was activated or not?
So that would all be part of our information security structure within our technology organization.
And ultimately, is that your responsibility?
Ultimately, everything in the company is my responsibility.
United Health's most recent annual report to the SEC says that it has systems and procedures in place to detect and contain cybersecurity incidents, and that United Health regularly tests and updates continuity and resiliency plans to, quote, contain and remediate potential disruptions or cyber events. United Health systems for detecting and containing cybersecurity incidents apparently did not work between February 12th, when the hackers gained access to Change Healthcare, through February 21st, when they carried out a ransomware attack. Did United Health ever test its cybersecurity infrastructure or protocols for a scenario like what happened in February?
So again, thank you for the question. We certainly do test those systems. I cannot describe to you whether or not Change Healthcare had tested those systems prior to them coming into our organization. That 9-day period is very much a focus of also whether or not there was a failure of a system there or some other reason why the systems didn't pick up what was going on.
And what continuity and contingency plans were in place prior to the attack, and were they intended to account for disruptions at the scale we've seen over the last 2 months?
So significant contingency and backup plans are in place across all of our systems. However, in this particular attack, and partly because of the age of the technology within Change Healthcare, which had been built up over many decades, the way in which the encryption ransomware was essentially detonated within the system affected not just the prime systems, but the backup systems as well, where they were not in the cloud. And some of the systems at Change Health, some of the key systems were not in the cloud. Where they were in the cloud, we were able to bring them back up very rapidly, and some of our services were back up within just a day or two. But for the ones which we've seen the most disruption, what we saw there was essentially an impact across both the backups and the prime systems, which really I think is a consequence of older technologies, which, as I said, we were working to upgrade, but that process had not been completed.
Mr. Chairman, I'm out of time. I yield back.
Gentlelady yields back, and now recognize the chairwoman of the full committee, Ms. Rodgers, for her 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Whitty, we're all disturbed by the breadth of the impact of the healthcare system since February 21st as a result of this ransomware attack. You stated 9 days before the February 21st ransomware attack occurred, quote, criminals used compromised credentials to remotely access one of your portals. What do you mean by compromised credentials, and how did that happen?
So that refers to people stealing passwords, and I think you may be aware of people's passwords being stolen and sold on the dark web and that kind of thing. We believe through that kind of pathway, they originally got credentials which allowed them to access into the system and then and then use the server we've been talking about to prosecute the attack.
Okay. Switching gears, I've long said that I'm skeptical of arrangements where the insurer that is not trying to pay for patients' care maintains ownership over the doctor that's supposed to be providing it. United is the poster child for such arrangements as the single largest owner of physicians in the nation. I have a fundamental problem with the direction of consolidation in our healthcare system, and I believe that it's increasing costs and reducing the quality of care. And again, United is the poster child for this problem. You don't seem to agree with that, however. You recently said, and I quote, "We're a comparably small part of the $5 trillion U.S. health system." Now United has recently released a statement that said, quote, "The company has found files containing the protected health information, or PHI, or personally identifiable information, which could cover a substantial portion of people in America." Mr. Witte, if United were comparably small, how would it have the PHI of a substantial portion of Americans?
Madam Chairwoman, thank you very much for the question. I think the distinction I would draw between those two things is that Change Healthcare was processing about 40% of claims flowing through the system on behalf of all payers, not just United, but on behalf of everybody in the system. 4 or 5 other companies do very similar work, but that was a Change activity. Change itself was a relatively small company, had an important role, but was a relatively small company. If I look at United Health Group, we clearly have a presence in a number of insurance marketplaces. We're rarely the market leader. We're rarely number one in those situations, but we compete in all the key areas. And similarly, across the states, we have been developing what we believe is an improved way of ensuring higher quality care by aligning incentives between physicians and payers within value-based care.
Okay. And the chairman asked about substantial portion earlier. I'm going to move on. You've said numerous times that United's size has allowed it to recover more quickly than otherwise would have, and I think you're implying that the consolidation is actually good. The reality is that the American people don't want to be told that less competition, more consolidation is a good thing. They want to get the best healthcare in the world, from a system that is clear, understandable, and affordable. And I strongly recommend that you put your efforts towards creating that system. Mr. Witte, moving back to cybersecurity, if the Change Healthcare portal the hackers infiltrated has allowed users to remotely access your systems, the ranking member asked about why you didn't have the multi-factor authentication. Does the portal have it now?
Excuse me?
Does the portal now, today?
All active externally facing systems across United Health Group have MFA, and we have third parties testing those systems to ensure that they're operative. So as far as I'm aware today, that is the case. Now, I would say it's because technology is such a rapidly evolving space, we have to be relentlessly checking on that almost every day, because there's always a new application or something new happening. But the policy is very clear.
Thank you. I'm going to move on. How were the hackers communicating with United Health to get the ransom? Did you communicate ever directly with the hackers?
I did not. No.
How much did you pay in ransom, and how was it paid? Was it in dollars, Bitcoin, or other cryptocurrency?
$22 million in Bitcoin.
Bitcoin. What was the date that you paid the ransom?
I'm sorry, I don't have that to mind, but I can certainly get back to you with that.
Can you thank you. Can you affirmatively say that the hackers you paid did not make copies of protected or personal data and then at a later date uphold it onto the internet or the dark web?
I cannot affirmatively say that, no.
Okay, thank you. I yield back.
And lady yields back. Now recognize the ranking member of the full committee, Mr. Pallone, for his 5 minutes of questioning.
Thank you, Mr. Chairman. When United Health Group acquired Change Healthcare for $13 billion in 2022, it touted the essential role that data interchanges play in our healthcare ecosystem. A press release from United Health at the time stated that the acquisition would, and I quote, ensure physicians get paid more quickly, accurately, and reliably, and yet the exact opposite has happened here. So, Mr. Witte, I don't understand how your company, one of the largest in the country, allowed a disruption of these services to persist for so long. I know that you said, unless I misunderstood, I think you said a few times that you acquired old systems, old technology that needed to be fixed, but you had a year and a half from when you acquired it until this cyber attack. So I don't understand why you couldn't correct it and why you didn't have an adequate backup. Why did it, if you had a year and a half, why couldn't you correct that, and why didn't you have an adequate backup in place?
Mr. Congressman, thank you very much for the question. Certainly, as soon as we were able to close the transaction for Change Healthcare, we began the process of upgrading the systems, both in terms of its cyber defense as well as its core technology. But as you might expect, in a business which had been around for about 40 years, from its very first layers of activity, it's a very complex technology environment, which takes time to upgrade.
But my point is, obviously, you're saying it would take more than a year and a half, but knowing that, shouldn't there have been some kind of a backup plan in place?
So, very unfortunately, in the way this attack took place, it implicated both the prime and the backup environments for many of the systems. That particular ransomware attack made those backups inoperable. That's one of the lessons we have to learn from this in terms of how we build true isolation of backups and maybe just emphasize the point about the importance of having those services in the cloud versus on older on-premises data centers, which was the case in the legacy Change environment.
All right, let me get I have 3 questions. I want to get the second and third. Now, there's a lot been said by my colleagues about small providers and pharmacies that were particularly hard. And I know you had workarounds like manually typing claims, these types of things that required hours of labor and a lot of upfront costs. So, I mean, were these, I'm told these workouts were not realistic. And I just, I'm wondering why, whether you actually believe that these workouts for small pharmacies and providers did the trick. Weren't there a lot of problems with their ability to do that? Do those still persist?
Thank you for the question. I think the most important workaround was to encourage providers to divert to other clearinghouses, and a very large fraction of providers did that. I do acknowledge and recognize that, particularly for small providers who maybe didn't have that ability to make that quick switch, it was definitely more challenging. And that's why we've put in place the funding program to support small providers, recognizing that they probably have the longest disruption in terms of their cash flow support. And the majority, I believe the majority, certainly a large fraction of the $6.5 billion of interest-free loans we've issued have gone to small providers.
All right, then let me ask you again about these small providers. Now, even though you are getting the system back online, they need to reconnect, right, to your system. And what is your company doing to meet, the Change Healthcare users or their needs that may not have the same resources as large hospitals to reconnect to those systems? And are you going to commit to continue to provide assistance to them so they can reconnect?
Thank you, sir. Yes, absolutely. And we're reaching out to providers actively as each system comes online to help them make sure that they have the technical capability to reconnect. And if any member in your districts have people who are struggling with that, if you could let us know, we would absolutely prioritize making sure we get connections. Key for us is knowing who has a problem. And as soon as we know, we will do that.
I appreciate your offer you made earlier, because we do have some that continue to have problems. And so through the chair, I do intend to get back to you and identify those for you. Thank you. Thank you, Mr. Chairman.
Gentleman yields back. Now recognize gentleman from Texas, Dr. Burgess, for 5 minutes of questioning.
Thank you, Mr. Chairman. Is there a generally available website or telephone number that a practice can call right now if they're continuing to have a problem?
Yes, and thank you very much for the question. So changesupport.com is the best website for anybody to access, whether it be a provider or an individual. But also I would very much like to note the 1-800 number that's available for individuals to call if they have any questions at all about data or anything like that. And that's 1-866-262-5342. That service line is available and makes available very quickly. It's a very simple process. If anybody wants things like credit protection, identity theft protection, those services are all available to be enrolled on just through a simple phone call.
Are providers still contacting you? As Mr. Pallone mentioned, he's continuing to hear from people. Are people still reaching out and telling you they're having trouble?
Sporadically, not so many, but I certainly encourage any member who has knowledge of folks who have continuing problems, please do send them our way, and we will either get them technically reconnected or we'll make sure that they have a robust offer of cash flow support so that they are carried through what's left of this cycle.
So a practice that uploaded data to the website, and the website gets hacked, and now the information appears on the dark web. Who is liable if a patient finds their information has been compromised? Obviously, they're going to go to their doctor and say, how did this happen? And then who has the liability for that data?
So, Mr. Congressman, thank you very much for that question. So first and foremost, we are offering to take full responsibility of all notification obligations for everybody involved in this. And we're working with the regulatory offices to manage that process. So ideally, we would like to take that over so that the physicians don't have to worry about those situations. We do have to make sure that the various regulatory oversight organizations support that approach, but that's very much the way we want to step in and take that responsibility.
Can we help you with that? Who are the regulatory agencies that would need to understand the importance of this?
So we're working with OCR within HHS, and those conversations are ongoing. I very much appreciate the offer, and if it's acceptable to you, I'll come back to you in the future if necessary. But today, those conversations are engaging, and I hope we'll be able to get to a simple solution which takes any of the anxiety of notification off everybody else's shoulders. We want to be able to do that.
That's good to know. It's beyond the scope of this committee, but you mentioned the Bitcoin ransom. I mean, are you working with the Department of Justice? I want to see someone arrested and marched into the center of town and shot for doing this. So are you helping law enforcement track these people down?
Absolutely. So in the very first hours, we reached out to FBI, and I'd like to acknowledge the fantastic engagement we've had from FBI through this entire period through to today. We've been every step of the way with FBI, and we will continue to provide them whatever information they need or is helpful to them to help them hopefully track down and catch these folks. And so I am completely aligned with you that I'd love to see these people brought to justice. And I hope we're the last people they ever attack.
And of course, one of the problems that this is not the first time that this committee has dealt with this, and over the years, there have been several. The problem historically has been these are actors from outside of the United States. And then it is hard to get foreign states to hold them accountable. So I hope we're willing to engage on that in a much more global sense. That this is a problem that's not going away. Again, I can remember dealing with this very same set of circumstances in 2015. And we just can't keep doing the same things over and over again. Let me just ask you this. There was mentioned in your testimony or over the Senate Finance Committee that there are loans to practices who are having difficulties with this. Those are low interest loans?
Yes, sir. So in fact, they're interest-free and no fee. And we've so far issued advance payments or loans of about $6.5 billion to about 142,000 TINs, so tax ID numbers, all interest-free, no cost, and no need to repay until the provider is back in normal cash flow.
Yeah, so I think that's wonderful, but how are you relying on self-attestation from the provider to tell you, hey, I'm back up to normal, now you can start? Essentially,
yes. We will work with providers. So far, we have not asked anybody to repay. Providers have begun to repay. So providers have begun to come back to us and say, we're back to normal, we want to start to repay, just beginning. But I think that's a good sign. However, there are others who are still drawing down some of these interest-free loans. So there's others who continue to need help. We're working with both ends of that spectrum, and we'll continue to do so.
If they continue to need help, I hope you provide it. Thank you, Mr. Chairman. I'll yield back.
Gentleman yields back. Now recognize the gentlelady from Colorado, Ms. DeGette, for her 5 minutes of questioning.
Thank you so much, Mr. Chairman. Mr. Whitty, in the wake of the cyber attack on Change Healthcare, you said, quote, I think it's important for the country that we own Change Healthcare, because otherwise it would have left Change Healthcare extremely challenged to come back. And I guess I think it may be true that the resources of United Health Group have allowed Change Healthcare to survive and recover, and that's good. I also think it's important that those resources be used to ensure the stability of the broader healthcare system. So I understand that Change's systems are being restored on a rolling basis. And good news, I've heard from some providers in my state of Colorado that they're largely back on track in submitting claims, although there are some difficulties, and we'll be sure to call you when we hear about them. But I think we need to do more work to get everybody reconnected. So I just have a few questions. Mr. Whitty, United Healthcare Group had just over $370 billion in revenues in 2023. Is that correct?
That is correct.
And the premiums on risk-based products make up about 80% of United Health's revenues. Is that right?
Yes.
And so the amount of that was just over $290 billion in 2023, correct?
Yes, I believe so.
So that translates to about $24 billion in premiums every month. Is that right?
That would be about right.
Okay. I point all of that out because while Change was down and United Healthcare was not paying out claims that it would have received through the Change Clearinghouse, providers around the country did not stop their work. And you referenced this before, they were spending money, purchasing supplies, paying salaries, keeping the lights on, but in many cases, unfortunately, payments weren't coming in. But yet, at the same time that happened, United Healthcare did not stop taking in premiums while Change was down and claims were unable to be processed through Change Healthcare. Is that right?
We did, but perhaps I could just explain that we continue to be paid premiums, but we also continue to pay on claims. And actually, United Healthcare was a relatively small user of Change Healthcare. So United Healthcare continued to be able to fulfill the vast majority of its claims during the month.
But still, okay. But all the payment to providers was not happening at that time, correct?
For a very small fraction for United Healthcare. For other payers, there was more disruption. Yeah.
Right, okay. Now, in the weeks after the attack, United Health Group, through its Optimum financial arm, began making loans to providers who use the Change system. So as of March 27th, as reported in the media, United Health Group had paid out advances of $3.3 billion to providers affected, and now I understand even more has been paid out. The loan program, as originally structured, required repayment within 5 days of receiving notice and allowed Optum Financial Services to take back funds without advance communication. Do you think those terms were fair? And are those terms that you would accept in your business?
Thank you for the question. Those terms were there just at the very beginning of the loan program, and we immediately realized they were not appropriate, and we got some good feedback from providers, which is why we eliminated all of those terms, and essentially the program which is in place and has been in place for several weeks now and represents the bulk of the payments has none of those terms associated with it, and I fully accept that that was a misstep in terms of how we designed that program.
So would you say that your terms now are fair, are treating providers fairly, and are not unnecessarily auditing or denying providers' claims?
I do believe that, and as we have in place today, interest-free, no-fee loan, essentially based on the provider's declaration of the impact they have suffered, so not dependent on our assessment. They define what they need. We advance those loans, and they only need to repay those loans 45 business days after they have confirmed they're back to cash flow normal.
So those are clearly more favorable towards these entities. But, and I appreciate you changing that, but I will reserve the right to ask additional questions if I hear otherwise from the providers. I yield back.
Of course, thank you.
Gentleman yields back. Now recognize the Chairman of the Health Subcommittee of Energy and Commerce, Mr. Guthrie, for his 5 minutes of questioning.
Thank you. Thank you for being here. So, Mr. Woody, according to United Health Update last week, your payment systems are functioning at 86% pre-incident levels, and your eligibility criteria systems are functioning at 80% pre-incident levels. When do you expect these core functions to be fully restored, and what do these delays in getting the systems fully restored mean in practice?
Thank you very much for the question, sir. We've made progress in bringing most of the core functionality back to very high restoration. So pharmacy, for example, main claims, eligibility, and the like. Change Healthcare had several different clearinghouses, and the residual part of some of that restoration is associated with remediating or restoring the last of those claim house, in fact, the oldest piece of technology within the Change network. That's why that 86 is not 100.
So what's the meaning? What in practice does this mean for people who repairs, receivers, people getting?
So for those folks who were on those very old systems, if they've been able to connect to a different system, so we're right now working with people to connect them into the more modern platforms which have been brought back online already, or divert them to a competitor of Change so they can get running. In the very small number, and I accept it's not zero, in the very small number of folks who cannot do any of those options, then we continue to provide the loan guarantee service until we get them fixed over the next few weeks.
Okay, I had a similar question to Ms. Castor, and I understand you talked Change Healthcare was created over time and had older technology. I assume you've gone through everything and Change Healthcare since then to ensure there's not another portal that can be exploited.
So, as I said, the UHG policy is MFA protection at the external interfaces. That's something we've been very rigorous about, and I feel very good about where we are on that, and we're using.
There's not other legacy equipment from Change Healthcare that's
We are relentlessly trying to extinguish that possibility. We're using third parties to make sure that occurs. What I would also say in the reconstruction of Change, so one of the reasons why it's taken longer than you may expect to bring back Change is because we're building much of this platform from scratch with brand new modern technologies, often cloud-based, with much greater built-in security capabilities than anything that pre-existed the attack.
Okay.
So both in terms of diligence around protection, to your first question, but then also in how we're redesigning and constructing the platforms, also is building in greater strength. Now, at the same time, we continue to be under enormous attack, just like everybody else in healthcare.
Okay, thank you. In December 2023, the FBI, HHS, and Cybersecurity Infrastructure Security Agency issued a joint cybersecurity alert detailing the methods a sophisticated Russian hacker group Alpha 5 Black Cat deployed to gain access to critical infrastructure, and especially, as you just mentioned, healthcare systems. Included were mitigation recommendations to help protect these breaches. Did Change adopt these December 2023 mitigation recommendations, and which of these are already in place ahead of this joint alert?
So across UHG, we certainly had those sorts of protections in place. Unfortunately, in this particular case, there was a server within Change which, for a reason we're still trying to investigate and understand why, did not have that protection in place.
Is this the first data breach since United Healthcare acquired Change Healthcare? And if not, I would go and ask my second question to that, my follow-up. If not, what steps were previously taken following earlier breaches to strengthen your?
So every time we've had either a breach or a near miss, we always go back and look at lessons learned and how we can strengthen. That's led sequentially to continuous raising of standard protection levels, layers of protection, new approaches. But we're also dealing with a series of threat actors who continuously change their targeting approach and the way they do it. So every time we go back and do root cause analysis and then figure out how to solve for that. Of course, we're doing that right now. We've expedited that in this Change situation, and we've already brought in a whole series of new extra levels of screening for the company. We've brought third-party leaders in cybersecurity to actively permanently work alongside our own security organizations, so we have more than one organization screening everything in the company, as an example.
Okay, thank you. Well, I don't have enough time for a second question, so I'll yield back 9 seconds.
Thank you, gentlemen, for yielding back. Now recognize the gentlelady of Illinois, Ms. Schakowsky, for her 5 minutes of questioning.
Thank you, Mr. Chairman. I have 3 questions. I'm going to ask them all because I want to make sure I get them all asked. I think they're very simple. I want to tell you about a constituent, Peggy, who's from my district, who spent an entire weekend without her medications, and then had to drive 40 miles in order to get a doctor's certification that she can get her prescriptions. And some patients, because of the situations that you've had, have had to pay even thousands of dollars. And I wanted to know in my first question how United is planning to compensate these constituents and these people. And I think that question was asked, but I'd like to hear it again. I have another constituent, my second question. Beth runs a mental health clinic that addresses pregnant mothers. And because of the cyber attack, then she is now in a very serious situation in terms of making her program work at all. She is in desperate need right now. And so question 2 was, what is United doing to address the problems that these providers are experiencing right now? And last is this question. I know that let's see. I'm trying to find it. Here, help me out here. Okay, oh, that's it. Okay, I'm sorry. Watching the time here, I got it. What is the first word? Okay, yeah, Change Healthcare, of course, suffered from this very bad, what is it? Oh, actually, the data breach that I wanted to talk to you about. Here we go. United had promised earlier that it would have absolutely robust security. So the final question is, why should we feel confident right now that there are not going to be those kind of data breaches? And also, I wanted to ask if have any United employees gotten their hand on any of the data from consumers?
Congressman, thank you very much for the questions. Let me first of all say how sorry I am to hear about Peggy, your constituent, in the first example you gave. I'm aware of a number of patients who've had similar inconvenience and difficulty getting their medicines. Several things we're trying to do there. First of all, we're making sure that pharmacies are held harmless if they have dispensed a medicine without knowing whether it would be under benefit or not, so that they should not be exposed to that. And if there's anything we can do to help, if there's an out-of-pocket cost associated for this particular patient, we'll be more than happy to help.
We're going to let you know.
Absolutely. As far as Beth is concerned, the a small mental health clinic would be very much qualifying for our interest-free loans to help cover their cash flow needs until they resume to normal. So again, we can help very directly to make.
These are loans at what rate?
Excuse me?
Is there a rate?
No, it's
for repayment?
interest-free, no cost, and they don't have to repay until the business is back to normal under their definition. So when they are happy that they're back to normal,
Okay.
then we repay. And then in terms of reassurance, many things we've done since this attack, but maybe the most important thing I could just share with you is the bringing in of the leading cybersecurity external organizations who are now also overseeing our security environment to make sure that we...
Have any employees ever gotten a hold of that data?
I'm not sure I know what you mean in terms of got hold of the data.
Well, if we're talking about these kind of data breaches, wondering that no employees got any of that information.
So I'm not aware that any employees got the information inappropriately. We have retrieved the information, which allows us now to investigate it to notify people. So employees are looking at it from that point of view under the process of notification.
Thank you. Yield back.
Young lady yields back. Now recognize the chairman of the Energy Subcommittee on Energy and Commerce, Mr. Duncan of South Carolina.
Thank you. It's been a long day with the Secretary of Energy in earlier, but Chairman Griffith, thanks for holding this important hearing, for your leadership on oversight matters. Mr. Whitty, I represent rural district of South Carolina, which consists of many providers that rely on your services, whether that includes community pharmacists, community health centers, or faith-based therapy services. Constituents of the 3rd District of South Carolina rely on these providers to improve or maintain their quality of life. Providers need to know that they can trust or rely on your services without delay and to process their healthcare transactions. During the first 2 weeks following the attack, if smaller providers in financial need wanted to communicate with Change Healthcare, how did they do so?
During the first couple of weeks, through their service representative would probably have been the best approach. One of the challenges I think we've realized through all of this is that many small providers didn't have a direct relationship with Change or even United, but they would operate through an intermediary company who then they themselves had connectivity.
So they couldn't call you directly?
So difficult.
Do y'all have a phone number that they could call, an email address that they could email you?
So we made sure as soon as we understood what was happening here and the disruption was going to be more than very brief, we set up weekly and oftentimes more than once a week briefing calls for participants in the marketplace and also made available various website sources of information.
Was every provider who reached out to Change Healthcare after February 21st responded to?
I hope so, but I would hope that that would be the case, but...
So no provider was left in the dark when they reached out?
Our goal was to try and be as responsive as we could to every provider who reached into us. I know at the beginning there were some providers who reached and were frustrated at, for example, the terms and conditions of the loan program, and I just repeat again that that's why we changed those terms and conditions. So I know for some providers they reached in, they didn't like what they heard, disappointed by that, and I'm sorry for that. And that's why we changed those programs and completely eliminated those restrictive terms and conditions.
Are you able to testify your communication with providers affected by the February 21st incident is as good today as it was in the first 2 weeks after the incident?
I think we have continued to try and improve at every stage how we communicate. And in the early days, I'm sure there are lessons we could learn to do better. And I think one of the challenges which we had within this attack is that our customer database for Change Healthcare was encrypted in the attack. So we were somewhat blinded to our ability to communicate with people. We continue to reach out. We've sent hundreds of thousands of emails. We've used our United Healthcare provider bulletin to try and communicate. We've reached out to other healthcare associations to ask them to reach out. And as I said, we've run a number of national calls to try and get the word out around where service was, for example, the loan programs, to make sure providers knew about it. But I accept that there's a risk people don't hear.
Well, what I'm hearing from you is that y'all push a lot of information out versus being very receptive. I mean, setting up a call center where people, they know they had an account, they know they had a payment processing issue, somebody they could reach out to. Mr. Chairman, I ask unanimous consent to insert in the record Wall Street Journal article entitled United Health Grapples with Communications During the Hack Crisis from April 3rd, 2024.
And we'll take that up at the end with our list, but I don't
Yeah,
expect there to be any problem. Also, I had one for patients struggle to get life-saving medication, which I referenced previously.
Yeah, thank you. Mr. Whitty, I appreciate y'all being proactive, pushing information out. But I think based on what I've researched, a lot of people were left in the dark and had no access to get their questions answered. And I would recommend some sort of call center and some sort of communication, because these folks know they have payments in process. They could have provided y'all a lot of information that you weren't able to get through your own system that was compromised and locked out. So the customers know what they have in process. They know they have business with you guys, and it would have been very helpful. So going forward, setting up a system where those folks can communicate with you directly versus just pushing information out with, check marks on a computer screen or an X showing that these things haven't been done, might be a little better. But I appreciate you being here. This is very informative. I yield back, Mr. Chair.
Gentleman yields back. Now recognize Dr. Ruiz of California for his 5 minutes of questioning.
Thank you, Mr. Chairman. I'm going to take advantage and talk about prior authorization here. Prior authorization requirements can delay care and deprive patients of needed services. Early in the outage, providers expressed concerns that insurers were not appropriately modifying their prior authorization practices to help providers who could not process prior authorization for services during the outage. Though I am pleased that UnitedHealthcare waived or suspended certain prior authorization requirements for some Medicare Advantage plans and services during the disruption, prior authorization remained in effect for non-Medicare Advantage plans and some outpatient services. Why, Mr. Whitty, why did UnitedHealth Groups only suspend prior authorization for its Medicare Advantage plans and not all of its plans affected by the outage?
Mr. Congressman, thank you for the question. You are absolutely correct. We did suspend temporarily our prior authorizations for Medicare. That's really the one group or the one part of our business where we essentially have the ability to make that decision very quickly.
And so why did you decide to do it for Medicare Advantage and not all of its plans?
So we did it for all of our Medicare Advantage plans. Medicaid is a decision for the states, and the states needed to make those decisions. And then for the commercial marketplace, that's an employer-based decision.
Okay. And Optum's March 7, 2024 press release stated that even within Medicare Advantage plans, prior authorization would remain in effect for durable medical equipment, cosmetic procedures, and Part B step therapies. Given the size of the disruption, why did UnitedHealth Group not waive prior authorization for all services affected by the outage?
Those were really where there are safety concerns and making sure appropriate use. And within the prior auth programs, making sure that people have safe access to the appropriate care was important. And we believe that by making those steps, and I think CMS felt good about what we were doing within that set of decisions, we were making the maximum contribution we could to lift in prior auths.
Okay. The same press release read that UnitedHealthcare would resume prior authorization on March 31st, but as we know, some Change Healthcare systems remained offline beyond the 31st. So is your company still offering any prior authorization suspensions or waivers for users whose systems are still offline?
Thank you, sir. We actually did not bring them back on March 31st. We brought them back on April 15th when the major systems were back.
Providers who took advantage of these flexibilities are understandably concerned that they could be subject to cumbersome audits and that UnitedHealth Group might second-guess some of the decisions users had to make while systems were down. This would put further strain on time and resources, particularly for the small providers who have already experienced tremendous hardships from the Change Healthcare disruption. So can you provide any assurance that UnitedHealth Group will not pursue unfair retroactive denials and clawbacks based on services providers performed while prior authorization was waived for certain plans?
I can certainly give you that assurance, yes.
Thank you, Mr. Whitty. That's very important, very important. We'll be keeping a close eye on the recovery process to make sure all providers are able to resume regular operations and patients can be confident that they have consistent access to the care they need. And with that, I yield back, Mr. Chairman.
Gentleman yields back. Now recognize Mr. Palmer of Alabama for his 5 minutes of questioning. Gary?
Thank you, Mr. Chairman. Mr. Whitty, based on initial targeted data sampling to date, your company found files containing protected health information and personal identification information, which could cover a substantial portion of the American people. That's what you said. Where did you find those files you referenced? On the internet, the dark web?
Thank you very much for the question. So,
Just be brief.
several weeks after the attack, we were able
No,
to...
I just asked you, did you find them on the internet or on the dark web?
No, those are in the data that we were able to retrieve. So we were able to retrieve a copy of the data, and it's in that investigation that we have
Okay.
found them.
And you said it's likely to take several months of continued analysis before there's enough information available to identify and notify impacted customers and individuals. Are you telling us that the fallout from your cyber hack could last until Christmas?
I think the operational impact that we've been talking about a lot just now is rapidly coming back to normal. I think it will take us
But I have a different point now. I think my colleagues on both sides of the aisle have done a really good job of addressing the customer impact and the healthcare provider impact. There's another issue that I'm concerned about because there are thousands of government employees, including many federal employees who have very high level security clearances, who are customers of United. Were any of the government employees' healthcare records who are federal government employees a part of the data files that were accessed by the hackers?
So we continue to investigate those files. We have not completed that process.
Well, you should know by now whether or not federal employees' files were accessed.
So what I would expect is that within the data, and what we're seeing within the data is it represents a mix of who used it.
Mr. Whitty, I understand you're trying to avoid a direct answer to a direct question. Were there federal employees' records hacked? It's important because if federal employees with national security clearances, high-level security clearances, had their personal identifiable information there, and particularly their personal health records, do you understand the problems that could create down the road for us from a national security perspective?
Absolutely, sir. I fully understand
Okay.
that.
What I'm asking you is to make it a priority, to find those individuals, to notify them, because I think it's extremely important that we do that, Mr. Chairman. So can we get an assurance from you that you will make that a top priority? It's particularly for people who work in top-level positions in our national security.
Absolutely, sir. That is a priority for us. We'll go as fast as we possibly can, and we will get that notification appropriately communicated as fast as we can.
Well, as I was saying, it raises serious concerns for me about the possibility of a breach of national security if some of this information is handed over to adversarial nations, and it's very likely it will be. So I think this should be a top priority. I'm not discounting the need to make sure that your customers' records are protected, that their health care bills are paid for, that the providers are compensated. But there is this next level that I think should raise concern for every member of this committee, Mr. Chairman. With that, I yield back.
I 100% agree with you, sir, and please be assured it is the top priority for us to deal with.
Thanks, sir.
And I'm sure that Mr. Palmer will follow up with a question for the record, but also you may want to get that information to our committee as to what you're doing to make sure that those folks know if there's a risk that they might be looking at blackmail or something else from a foreign adversary. With that, the gentleman has yielded back. I now recognize Mr. Tonko of New York for his 5 minutes of questioning.
Thank you, Mr. Chair. First, let's take a moment to recognize that this breach has greatly impacted a lot of critical institutions, providers, and patients in our communities. Personally, I have heard directly from providers, hospitals, pharmacists, home care providers, and so many others from New York's 20th district. I want to make certain everyone knows that this is unacceptable and that we need to make sure there is accountability and oversight to ensure nothing like this happens again. With United Health's announcement last week that hackers may have accessed protected health information for a substantial portion of people in America, some of our worst fears are coming true. The sensitive health data of tens of millions of Americans is at risk. That's why HIPAA is so important. HIPAA, cybersecurity, requires establishing minimum data security standards for covered entities like United Health Group to try to prevent breaches of sensitive data. Mr. Whitty, while the HIPAA security rule provides covered entities with some flexibility in determining how best to secure protected health information, it does require that companies, and I quote, protect against any reasonably anticipated threats, which, as your testimony points out, an attack like this was. So is it your position that United Health Group and Change Healthcare were fully compliant with the HIPAA security rule, even though multi-factor authentication was not being used for remote Citrix access and your systems failed to detect and prevent the attack?
Mr. Congressman, thank you for the question. So compliance with HIPAA is a top priority for us as an organization. I believe across our organization we take that incredibly seriously. Unfortunately, in this situation, there was a server which did not have MFA, and it was used by the hackers to penetrate into Change Healthcare, which was a platform which had only recently become part of the company, was in the process of being upgraded.
Thank you. Did United Health Group conduct any audits or other tests to ensure that Change Healthcare systems were fully compliant with HIPAA's security rule and also were in line with industry best practices?
Because Change Healthcare was a public company prior to acquisition, we're prohibited from doing any pre-acquisition audits of that type. Once we acquired the company, we began to go through the process of understanding it. But given its size and complexity, that takes some time to do. It was underway when this attack had happened.
Thank you. And HIPAA also requires that a risk analysis be conducted, part of your company's security management processes to identify and address potential risks to protected health information. Did Change Healthcare conduct such an analysis after being acquired by United Health Group? And if so, will you be changing how that risk analysis is conducted going forward to account for what went wrong in February?
So certainly thank you very much for the question. Certainly we are reviewing all of our management of those types of risks to make sure that we are eliminating any residual risks in that context, yes.
And HIPAA requires that covered entities file a breach notification with HHS's Office of Civil Rights within 60 days, I believe, of discovery of a breach of protected health information. As of today, more than 2 months after the ransom attack, you still have not filed that mandatory notification. Why have you not yet filed a breach notification with HHS, even though you have been aware of a data breach for over 60 days? And when do you intend to bring United Health Group into compliance with that requirement?
Thank you very much for the question. What slowed us down at the beginning of this was being able to get access to the data so we could understand what data had actually been exfiltrated. We did not have that until the middle of March. We have been working diligently with external third parties to understand that data, and we're working with regulatory authorities exactly on the question you raised.
I appreciate that. We are still trying to grasp the full consequences of the cyber attack and the data that was compromised in the process. As a result of the health data that was stolen, harms to individual patients could continue far into the future. So I eagerly await the findings of ongoing investigations at United Health and by HHS so that there can be a meaningful accountability and hard lessons can lead to improvements across the industry. And with that, Mr. Chair, I yield back.
Gentleman yields back. Now recognize the gentlelady from Arizona, Ms. Lesko, for 5 minutes of questioning, and she's also the vice chair of this sub. Thank you, ma'am.
Thank you very much. Thank you for being here, and I guess you've had a long day. I have too, but you're on the hot seat, I guess. I have a couple questions. The first one, does United Healthcare and Change Healthcare have its own cybersecurity employees?
Yes, they do, Madam Vice Chair, yes.
Okay, and what vendors, if any, did you use when this breach happened?
In terms of the response to the breach, a number of different vendors, but most notably, I would say Mandiant, Palo Alto Systems, and a company called Bishop Fox, but many others, including the the significant technology companies, but from a cybersecurity advisory capacity and testing capacity, those groups. And I might add also that we've now asked Mandiant to become a permanent advisor to the company, in fact, to the board of directors, to make sure that at the very top of the company we have the most elite cybersecurity advice available.
Were they working while the breach happened? Were they on one of your vendors while it happened, or that was after the fact?
Those are vendors who were brought in after
Okay.
the attack.
I was just curious. I'm just curious who the vendors were that were supposed to be doing cybersecurity for the company so that people would know, are they doing a good job or not? So do you know who the vendors were?
I'm afraid I don't.
Yeah?
I can't.
Okay.
Don't have those names for you today. No.
Okay, sounds great. And I think you've said you've reviewed your decisions on cybersecurity. Have you come up with any analysis of how you're going to change things besides using Mandiant?
So thank you for the question. So first of all, we've brought into the organization supplemental screening capabilities with third-party organizations, so making sure that we have secondary and tertiary level screening going on in the organization in addition to our own capabilities. And we're also reviewing through our investigations any lessons learned from this attack, which will obviously not only be implemented across United, but we'll share with other partners in the system.
And did your insurance cover the cost of the ransomware?
We're self-insured in this situation.
I have a switching subjects a bit. I've gotten letters on this. This is why I'm asking it. Does AARP get a paid percentage on your AARP United Healthcare Medicare Advantage plan? Do they get a cut of it?
I do not have the details of that arrangement. It's a very long-standing old arrangement, but there is an economic relationship. But I'm afraid I do not have the details. I would not like to give you an incorrect answer.
Okay, could you just make sure that
Yes.
the committee has it, because I'm getting all kinds of letters about it. And then my last, it's not a question, it's just a comment. This was a few years ago, but when I was helping my mother sign up for Medicare, it was very difficult, all right? And so she ended up using the AARP United Healthcare Medicare Advantage plan, but I have to say the listings that the insurance companies had for the doctors were not very accurate, like who was covered. So for instance, I remember like it was listed, a doctor was listed as a primary care doctor, but when I called them to make sure they were still taking patients, they were a cancer specialist or something. So I would encourage not just your insurance company, but all the insurance companies, that it is extremely confusing for me, let alone my mother. My mother wouldn't be able to do it, I don't think, at all. And if there's any way you guys can fix that, I would greatly appreciate it.
Well, I very much appreciate the observation. I agree with you. Provider directories, that reliability of provider directories to make sure a patient, when they walk into the reception of the facility, knows they're going to be accepted is super important, and it's not good enough. We would love to see that improve. We're working hard ourselves, but it's something we all have to do in partnership, and we'd certainly like to work with policymakers on this as well, because it's really a national challenge.
Yeah, well, I appreciate you coming here. I know this is a problem, but it's not just your company that's been breached. I mean, I probably get a letter maybe every 3 months saying something's been hacked into my information, and, oh, I'm going to give you, a year's worth of credit agency. And I was like, well, that's not going to help me very much, but okay. But it's not just your problem, it's a problem nationwide, worldwide, and I don't know how we're going to address it, but we got to. Thank you.
Gentlelady yields back. Now recognize the gentleman from California, Mr. Peters, for 5 minutes of questioning.
Thank you, Mr. Chairman. Thanks for being here, Mr. Whitty. This disruption has underscored the need for actors across the healthcare system to invest in and maintain cybersecurity practices. In 2021, we saw this back near my home in San Diego when Scripps Health was the victim of a cyber attack that compromised sensitive patient data and lost scripts more than $100 million in revenue. You know, I reflect that we are an economy of private actors, and many cases they're performing public functions. And here's the healthcare system. I don't advocate a public healthcare system, but I do think we have to look out for the people who are in that healthcare system, much as when Equifax had a breach in the lending area. We have to pay attention to that, and now we're paying attention to how people get their news and whether that's distorted through private actors like TikTok or even Instagram, or Facebook. So this is an important hearing, and I know you're still in the middle of your investigation, but I hope at the end, I would not intend to drag you back here for another day of this fun, but I would like to have the information help us with national standards that we might use for other health systems to make sure that all the people who are getting health care throughout the country are protected from this kind of thing in the future, and I hope that you'll commit to do that for us.
Mr. Congressman, thank you very much for your comment and request, and of course, very happy to share with you, as appropriate, the lessons learned from this. I'd also just like to reassure you about the scale of our commitment to investing in modernizing in cybersecurity protection. We invest about $300 million a year just in cybersecurity. That's not technology, that's cybersecurity. The groups which in it, I would really encourage some of the focus, as you described, policy reflection, is on some of the small and mid-sized organizations across the country who just don't have that kind of capacity to invest in the kind of technology. So totally agree with your observation, and if we can help, we absolutely will.
And again, we appreciate you're in competition, but this is sort of a lessons learned, because when this happens to one organization, I think it can affect the whole healthcare system. So it's critical that providers, pharmacies, payers, everyone begin work to harden their data systems to quickly recover from breaches while keeping our protected health information safe from outside threats. So again, recognizing that you're in the middle of this, do you now know specific improvements that United Health Group is going to make to its protocol for cybersecurity to prevent and respond to ransomware and other cyber attacks, particularly what additional systems now require multi-factor authentication, what different protections are now in place for backup or redundant systems? What specifics do you know today?
Thank you very much for the question. So maybe just pick a couple of examples. So certainly enforcement of our policy to have multi-factor authentication on all of our external services, but also having an enhanced screening capability to make sure they are constantly on and operational. So I would call that as number one. Number two, as we've rebuilt the Change Healthcare environment, we've redesigned it to partition those environments in ways they were never envisioned 10, 15 years ago. So in the way in which we design our systems, we're trying to make them much less easy to navigate. And we're focused on how we screen to make sure complete compliance with the policy we have on things like MFA. In addition to that, we've brought in third-party screening organizations to give us a double check on making sure that any abnormal activity we spot as quickly as possible.
When you think you're going to have this solved, how are you going to get your customers to be confident in that?
Thank you very much for that question. That's been very much a focus of the work we've done, and it's why we decided to rebuild Change essentially in a new environment and not try and resuscitate the old system, because it would have been very difficult, maybe impossible, to persuade people to reconnect to a system which had been attacked with malware because of the risk of contagion or something like that. So we've endeavored to build new platforms. We've had those platforms tested by all the best cybersecurity companies in the country, including aggressive penetration tests to prove that they can withstand the highest levels of assault. That we share that information with key partners in the system who need to connect with us.
Last question. What lessons do you have for us about what HHS can take away from this about working with healthcare systems to support them and make sure that they don't go through this again?
So first of all,
Health and Human Services, Department of Health and Human Services.
First of all, we've had a very regular and ongoing relationship, particularly with CMS during this crisis, who have been extraordinarily supportive and engaged and forward-leaning. I think the areas where we could all work together are things like communication to providers, and a question that came up a little earlier. I think that's an area where we could work together to figure out how to communicate more rapidly through the system. And I think making sure, let me say that would be probably my top recommendation to go, and I recognize my time is out.
Thanks for being, my time is up. Thank you, Mr. Chairman, for indulging that question. Thank you.
Gentleman yields back. Now recognize Mr. Bouchon of Indiana for 5 minutes of questioning.
Thanks, sir, for being here. I was a doctor before. Some of my comments will be tainted by that. So you couldn't investigate Change Healthcare before you purchased them to find out that they had an insufficient cyber program and that they weren't in compliance with federal government recommendations that Mr. Guthrie recommended? You couldn't find that out?
Sorry, during the acquisition phase, and as you may know, in the case of Change, that was quite a prolonged process. That would be regarded as gun jump in terms of engagement. So you really have a kind of closed wall between the two companies until after the transaction.
I get it. I mean, you buy a new house, you want to know if the sewer line's bad before you buy it, right? Yeah, I firmly believe that consolidation in healthcare is not a good thing, okay? It's led to increased costs. We know that. Even though everybody says it will decrease costs, it does not. We know that. Increased bureaucratic problems were very common. And ultimately, in my view, less quality care. It doesn't matter the industry. Doesn't matter the industry. Less competition doesn't encourage better quality service or products. It just doesn't. And in healthcare, it's on steroids right now across the country. My understanding is that most plans have deadlines, something like 60 to 90 days for providers to file claims for reimbursement. Is that correct?
Yes, that's typically correct.
So I've heard from a small clinic in my district processes just a few $1 million of claims through Change. And since the attack, the clinic's been filing claims manually. Obviously takes a lot longer. They really didn't feel like they had the ability to change clearinghouses. And my understanding, for these clinics, it might be helpful to have a filing deadline suspended or at least extended from from whatever their standard plan is. I realize Change has more than United Healthcare, but in your case, the United Healthcare, have you communicated with any providers who have expressed similar concerns? And do you intend to extend the timely filing deadlines for United Healthcare claims?
Yes, sir, we have. We've waived those deadlines, yes.
Okay. I mean, to me, it'd be reasonable to extend them to 6 months or something, but waiving them, I understand. And you may or may not want to comment on this. Should other health plans that participate in Change Healthcare extend their deadlines until we can be completely confident that this is fixed?
Well, thank you very much for the question. It wouldn't be appropriate for me to talk about what other payers should or shouldn't do. What we've tried to do at United is we've tried to offer every support and service and every lift of administrative complexity for the folks who have been impacted by this, and that's what we've been doing.
Well, I'll answer the question because my recommendation to all health plans that are affected by this to extend your deadlines. Because when you start denying claims for that, whoever does that is probably going to be sitting in your chair, answering why. I'm just recommending that to everyone out there that's listening to this hearing. Because providers that have been financially assisted because of the breach, right, and then they file their claims late, I can see a circumstance where then there's going to be a clawback. And what you've described, that won't happen from United Healthcare, but it is going to happen. And when it does, we'll, at some level in Congress, we will have a hearing on why that is. And so I would highly recommend people seriously consider giving people more times to file their claims if they've been impacted by this. Also, somebody brought this up earlier, but I've heard from providers that the provider assistant option from United is quote unquote terrifying. They believe it provides access to bank account information that goes beyond what is necessary, and say that under the terms of the agreement, United can simply change the terms and conditions merely by providing notice. That to me sounds like potentially an entity that wants to buy out clinics. Now, you've already answered that question. That hasn't happened, but I would highly recommend that anyone out there that's thinking about buying out clinics based on the fact they can't file their claims through Change would reconsider. Because again, they may be sitting in a congressional hearing explaining why they're doing that. And so have you read the OIG report, HHS OIG report on Medicare Advantage plans that's been published in like the last year or two? Do you know, are you aware of that?
I'm not sure about the specific one you're going to refer to.
Yeah, well, the one that says that claims are being denied 14% of the time roughly by MA plans that would be paid for by traditional Medicare. And if your team has not read the OIG report that talks about claim denials compared to traditional Medicare, I'd suggest that you do, because when I hear from providers out there, the number one name that comes up happens to be your company. And we need to fix that. I've worked on prior authorization. I know Dr. Ruiz has talked about this. With your indulgence, Mr. Chairman, just a couple more seconds. CMS has dealt with some of this. They didn't go far enough and in MA plans, and it's very disturbing practice. So I'd recommend that the team familiarize yourself with the HHS Inspector General report as it relates to this. And I yield back.
Gentleman yields back. Now recognize the gentlelady of Washington, Ms. Schreier, for her, Dr. Schreier, for her 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you, Mr. Whitty and Ranking Member Castor, who has let me take her seat. First, let me just thank Dr. Bouchon for his comments. We are definitely on the same wavelength today, and we're hearing the same stories. I know that you've been through a long day of questioning today, and I want to get right to the point. This Change Healthcare attack has been just devastating, and I'm extremely concerned that we're just seeing the start of the impact of this cyber attack. Not only have providers and hospitals been shortchanged reimbursement claims, not only has vulnerable patient data been leaked, possibly sold to a foreign adversary, not only were patients at least temporarily unable to access their medications, but I've even received reports from utilities in my district that they are unable to bill and process payments because Change was also their clearinghouse. And so the effects of this hack are really far-reaching. And frankly, the consequence of United Health Group and Change Healthcare's merger in 2022, a merger that the Department of Justice tried to block on the basis that it would give United control over half of Americans' health insurance claims. I think we all sympathize with this hack and what you have been through and appreciate the efforts that you have taken to help get through this. But the reality is that this massive, far-reaching attack has disproportionately impacted small, independent practices that were already struggling to stay afloat. And United's advance payments have been appreciated, but insufficient. And other payers, as you've just heard, have done nothing to help. It is in their interest to hold on to that money. I'm going to give you an example. Balance Physical Therapy is a private practice in Issaquah, Washington, that employs just 6 physical therapists. The Change attack has devastated them to the point where the owners had to mortgage their home in order to pay rent and make payroll. And now that money has run out. Mr. Whitty, your company reported $371 billion in revenue last year. Do you want to hazard a guess as to how much Balance Physical Therapy was paid in the first round?
No, but I'm very keen to hear.
Probably a good thing you didn't hazard a guess. $70. 70. You know, this is, after your kind of revenues, it seems like you have enough information to know what clinics billed in the prior month or even in that month the prior year that you should be able to do better than that. And I know you've said that you won't rest until you get this right. And so I guess one question for you is, to make this right, it'd be great to help repay that mortgaged home. Will you help with things like that to make these companies whole?
Madam Congressman, absolutely. Let me hazard, I think what happened here is that, in fact, we don't have visibility of non-United healthcare flows. And in the very early stages of this, we tried, because we were trying to help quickly, we tried to make some estimates, but as a consequence, we undershot, and in this case, massively undershot. The physiotherapy clinic you're talking about, I'm sure would be eligible for a very substantial loan, which would cover the kind of challenges they have, and that would be available to them interest-free, no cost, and not needing to be repaid until well after they are back to normal.
Okay, thank you for saying that. I want to jump right to that part about loans. Because another thing that I'm hearing in my district is that some of the loan conditions were very suspect. That many people, many clinics, even hospitals, decided not to take these loans because there were clauses in there saying that you could not use any of your competitors, that you could be asked to pay off this loan immediately, and that this could actually be used to, in a predatory way, almost to put these clinics out of business, because United does have a reputation for buying up clinics that are in trouble. And I would just like to hear whether you will guarantee that you will not damage these practices by not reimbursing sufficiently, putting these unfair terms on, and then going and just buying up the practice.
Absolutely, I can reassure you of that. And again, those terms you're referring to were unfortunately included at the very start of this process. We realized very quickly that was a misstep and a mistake, and we got rid of all of those terms. So all of those terms are gone now. It's an incredibly simple process. There was also to your second point, absolutely, we would never want to act opportunistically from the back of this. And where we've had agreements to acquire clinics, we've honored pre-existing cash flows before the attack so that they were insulated from it. And a very good suggestion came up this morning from the Senate Finance Committee, which we will institute, which is to put a firewall between everybody who knows and has visibility to these loans and those people in the company who are involved in potentially working with clinics who want to join the organization, to make sure that the risk you identified does not happen.
Thank you, appreciate that, and I will tell the clinics, and I yield back.
Gentlelady's time is up. She yields back. Now recognize the gentleman from Pennsylvania, Dr. Joyce, for his 5 minutes of questioning.
Thank you for allowing me to wave on Chairman Griffith and Ranking Member Castor, and thank you to our witness for appearing. The Change Healthcare attack caused massive disruptions in patient care and resulted in severe burdens for providers, for pharmacies, and hospitals trying to deal with the full impact of the hack on their daily operations. As we see increased consolidation in healthcare, I worry that incidents such as this will become increasingly more common. We have already seen consolidation drive up prices and decrease access to patient care. And now, patients and physicians are encountering yet another cost, and I might add a very significant cost, through the fallout from this cybersecurity attack. Mr. Witte, aside from your data business, that is our main topic of the conversation today, your company is the largest for-profit domestic health insurance company, and you also employ nearly 100,000 physicians in the U.S., making you the largest employer of physicians in the country. To better understand your reach into my home state of Pennsylvania, do you have the total number of employed physicians in the Commonwealth of Pennsylvania?
I'm sorry, I do not have that number.
Would you provide that? Would you get back to us on that number? Knowing that the scope of United Healthcare has become, what impact did the attack have on other United entities and subsidiaries aside from Change?
So thank you very much for the question. There was no direct impact, so there was no contagion of the attack beyond the Change environment because of the way in which we shut down all connectivity, which meant that the effect didn't spread to any part of United or to any other organization which was working with Change before the attack.
So most of the impact was on, as I mentioned, physicians, hospitals, and patients. Are you able to provide a breakdown of the total number of patients, doctors, pharmacies, and hospitals that have had a transaction impacted by the hack, either today or in follow-up in writing?
I think in the future we ought to be able to estimate that for you.
Thank you. We look forward to receiving that. One of the largest impacts that United Healthcare has on medical care every day is the use of utilization tools like prior authorization. In light of this cyber attack, for which services did United Healthcare suspend prior authorization requirements? And please explain the rationale for suspending that prior authorization for some, but not for other services.
Thank you very much for the question. So really, in line with suggestion, recommendation from CMS, we suspended Medicare Advantage prior authorization during the period of the acute phase of this. They were restored on 15th of April.
So you did not suspend prior authorization requirements for employer clients?
No, because those are for the employers to make the decision, and similarly, states to make the decision on Medicaid.
It is my understanding that prior auth requirements have now resumed. Is that correct?
On the 15th of April, correct.
Do you intend to pursue reimbursement for providers who provided service during that suspension that would have normally been required to have prior authorization and may have been denied?
No, we will not.
You will not provide reimbursement?
Sorry,
Or you will require or not provide?
we will reimburse, we will not deny.
So in other words, will there be retroactive prior auth reviews, or have you completely waived your Medicare Advantage prior auth policies?
We've waived for that period.
I think that we realize that some of the questions that you've answered for us today do provide that information that's so important moving forward. But the utilization that has been suspended needs to be carefully reviewed, because the prior authorization, whether it's with a Medicare Advantage or an employer contract, has impact. It delays care, it delays the ability for patients to seek that out. I think we could ask you to also follow up and carefully review how that prior authorization, how that has affected patient outcomes. And I think that's something you, from your perch at United, should be able to provide for us.
Mr. Congressman, be very happy to do that review. And let me go further than that to say we're certainly more than open-minded to work with yourself and others on ideas of how we can further improve ensuring both best quality, safest care is delivered alongside avoidance of waste, which is really the historic origin of prior authorization, as you know extremely well.
And I think safest care, I'm glad you brought that into the conversation. I think that is what really want that direct answer, to see how that prior authorization, since it's been suspended, to see that impact on patient care. I think that there are many physicians who serve on energy and commerce like myself. There are many healthcare providers. I'm sitting between two of them here today. I think that those are answers that we would all like to see.
Absolutely.
Again, Mr. Chairman, thank you for allowing me to wave on today, and I yield.
Gentleman yields back. Now recognize Dr. Miller Meeks of Iowa for her 5 minutes of questioning.
Thank you so much, Mr. Chairman, for allowing me to wave one to the Oversight Committee, and thank you, Sir Whitty, for testifying today. According to data from the American Medical Association, 80% of practices reported lost revenue from unpaid claims, and 85% stated they had to allocate additional staff time to complete additional administrative requirements. And we already have that burden. I'm a small business practitioner prior to coming to Congress. And neither doctors nor their non-physician staff will receive any additional compensation for the time spent mitigating the fallout of the change attack, just like we're not compensated for the hours in prior authorization time that we have to expend, or denials of claims that are then found to be valid. And this is on top of the administrative and financial burden that Americans' physicians and healthcare workforce are already experiencing. In Iowa, doctors are very hesitant to take advance payment dollars without confirmation that their claims submissions will be paid at the rate submitted, and are concerned that they will be required to pay back more than what ultimately will be approved for payment once the backlog processing is completed. The survey also found that 55% of doctors said they had to use personal funds to cover practice expenses. Notably, the overall effects of the change attack have been most acutely felt by practices with 10 or fewer physicians. Sir Whitty, what has been the uptake on UGH's advanced payment program among small physician practices, and what do you plan to do to offer more robust advanced payments, or with a particular focus on small providers?
Madam Congresswoman, thank you very much for the question. First of all, let me reassure you, we remain extremely focused on ensuring that particularly smaller providers, who we know are the ones who oftentimes have the most difficult technical challenge, or the limits to technical switching and the like, to do that, which is why we've made every effort we can to outreach through our loan program, and also simplified that loan program and eliminated some of the unhelpful terms and conditions at the beginning. I can tell you about 142,000 tax ID numbers have taken advantage of that loan program. I can't tell you how many providers are underneath a tin because it varies and they move from tin to tin. But 142,000, that's about a third of all the provider tins that were associated with Change Healthcare before the attack. So very substantial uptake. Very large fraction of those folks are small providers. And over the bulk of the period of the loan program, we were essentially auto-approving loans to small providers in a matter of hours. Now, I've already mentioned, and I fully accept, in the first week or two of the loan program, it was way too clunky, and we fixed that. And we've seen a very substantial uptake, and I'd also just like to reiterate that program remains open. We are still issuing loans to folks who need it, although we are now beginning to see some providers choose to start to pay us back, so as things start to normalize, but it is still open.
Yeah. There are only two platforms in the market, and this committee has been very concerned about consolidation in the healthcare marketplace. So Change and Relay. They are both owned by Fortune top 10 companies. In short, big data is big business. And as a country, we have a significant interest in avoiding 1 or 2 points of failure in our healthcare delivery system. How does United Change help our country accomplish that goal?
Thank you very much for the question. I would make the point that actually Change and its business was no different in terms of its footprint the day before the attack compared to the day before we acquired them. So Change, this risk, pre-existed the acquisition of United. What was different is that United has the financial capacity to resolve this issue, and I believe to rebuild Change into a much more modern, a much safer platform. So I do believe the issue of risk actually existed when Change was quite a small independent business, or in fact a public company, but quite a small public company. It came into the organization, and very unfortunately this attack occurred in the early days of us owning this business.
So I'm going to take a different tack, and this is a problem that I had in state government as a state senator, as a physician provider in a rural community, and that many people explained to me, and that is what PBMs, Optum being one, does when it comes to step therapy, switching of medications on which patients are compliant, they do well. This is especially true for different providers. And the ultimate risk and cost to the healthcare system in trying to save on a medication, having to revert back to a less expensive medication when you have finally got compliance on a medication and a patient, leading to increased hospitalization, increased ER visits, and then back to the same medication that an insurance company changed, a PBM changed, when a doctor had already prescribed a medication for which they're successful. So will you work with us on what you're doing on step therapy, drug substitution, changing in formularies, which is a tremendous problem. It is a great cost to the healthcare system being made by decisions by insurance executives rather than providers.
Yes, absolutely. And within our PBM, we rely on an independent drug and therapeutic committee advice, but I also recognize that sorts of situations you described do occur, and I'm very happy to commit to us working for ways in which we can improve that. We ought to be able to do better.
Thank you so much. I yield back.
Gentlelady yields back. Sorry, buddy. Now recognize the gentlelady from Florida, Ms. Kamick. 5 minutes of questioning.
Leave it to a gator to beat a dog.
Snuck in on you.
Sorry, that's college
Sorry.
football stuff. We have a rivalry going. Thank you, Mr. Chairman, for holding this very important hearing, and thank you, is it Whitty? Whitty, okay, just want to make sure I say that right, for appearing before us here today. So the April 3rd, 2024 Wall Street Journal article that my colleague, Representative Duncan, submitted for the record stated, quote, "Some who have taken loans from the company, United Health, to help with ongoing revenue shortfalls say that they have felt pressured by United Health to make upbeat public statements about the support. Do you know if anyone at United Health, Optum, or Change Healthcare communicated to smaller providers seeking financial assistance that they should make positive or upbeat public statements about the company?"
My understanding is that people from the company spoke to folks who'd received loans and asked them if they would help spread the word, because we were very keen to get other small providers aware of the program. We knew that was an issue. My understanding is that following that newspaper article, folks listened to whatever was there, the information associated, and I'm not convinced that accurately represented the situation.
Specifically, so to what you were saying, that there had been some sort of encouragement going on, do you know specifically who or what department would communicate that?
I do not, I'm afraid.
Could you find out and submit back to us for the record so we
I'm
have
sure
that?
we could find out.
Okay. Are you aware if United Health made receiving a financial loan conditional or on a provider making a positive public statement about United Health?
I've never heard anything like that, and that should not happen. I would be very disappointed if that had ever happened, and it, as far as I'm aware, is not part of any approval criteria.
Is there any formal investigation or looking into that you will do to ensure that that is in fact not the case?
I will absolutely undertake to double-check that.
Okay. Can you give us a timeline of when you'll be able to report back to us on that particular issue?
I will double-check that in the next week.
Okay. Did you know or authorize anyone at United Health or its affiliates to encourage smaller providers to seeking loan assistance to making positive statements about the company? Talking about the smaller.
Nothing really additional to what I've...
Gauge the bigger guys versus the little guys. And are you, let me see. Can you confirm if this public reporting is true? Speaking about you didn't think that it was accurate, talking about that particular article, that another cyber criminal group splintered off from Black Cat and is threatening to release patient data from the February 21st incident. Is that true?
So I am aware of a splinter group like that, which was making statements, I would say, up until the last couple of weeks or so, but I'm not aware of them still making statements.
Okay. And aside from Black Cat, has there been any other cyber criminal that has threatened United Health or asked you to pay a ransom related to the data from the February 21st attack?
Not further than what I've just said.
Okay. All right. With that, Mr. Chairman, I have no further questions. I appreciate your testimony here today, and I yield.
Gentlelady yields. Now recognize the gentleman from Georgia, resident pharmacist of this subcommittee, or this committee, Mr. Carter, for 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you for allowing me to wave on to this committee. Mr. Whitty, I practiced pharmacy, independent retail pharmacy for over 40 years, own my own business for over 32 years. One of the main focuses that I have set as my goal as a member of Congress when I started 10 years ago was to address the vertical integration that exists in healthcare, specifically in drug pricing, where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor. And in your case, you're the largest for-profit domestic health insurance company in the country, as has been pointed out, with over 10,000 physicians and owning your own pharmacy and one of the largest PBMs in the country. Can you explain how your company can justify these clear conflicts of interest?
First of all, sir, thank you for the question and the challenge. I appreciate that. We operate our organization with very clear firewalls between the organization, and we are guided around a mission of trying to align incentives in the system to try and eliminate waste and abuse and to try and deliver value-based care to individuals. We know that when that happens, clinical outcomes improve and we believe the cost goes down for people involved in that process. That's what we focus on through the organization. And as we look at the components of United Health Group, while we have a presence in many different areas, as you very rightly say, we are also not present in many other areas, so we own no hospitals.
How do you define anti-competitive practices? Do you consider any of these to be anti-competitive?
No, I do not. I think
so. When a PBM owns a pharmacy, that's not anti-competitive. Do you have plans that incentivize or require patients to use your pharmacy or to over an independent pharmacy?
Not to incentivize, and we offer alternatives.
You offer alternatives?
We have, for example, a mail-order pharmacy. Which
okay, are you aware that there are over 300 pharmacies, independent retail pharmacies, that went out of business last year? Are you aware also, and I'm sure you won't be, but earlier this afternoon, I had a call with a pharmacist from Pennsylvania who told me that 70 pharmacies have closed in the first 4 months of this year in Pennsylvania alone, 70 independent pharmacies. Is the reimbursement the same for independent retail pharmacy as it is for your pharmacy, for your mail-order pharmacy?
So
Is it, yes or no? I mean,
I think they're very different structures, and I don't have.
how can is the reimbursement the same?
They're very different structures, and I don't think I can give you a direct answer today. I can certainly go back.
And
and
if
look at
you
it for
would get me that information, I certainly would appreciate it. Are you aware, and I'm sure you are, that the Federal Trade Commission, after asking them since the time I've got up here to look at the conflict of interest, that they have launched an inquiry into the egregious practices of the largest 6 PBMs and the impact that they're having on independent retail pharmacies?
So I believe that the PBMs offer a very strong service.
Are you aware of the study? That's what I'm asking.
I
Yes.
am aware of the study. Yeah.
Have you been cooperating? Have you responded to and complied with the FTC's request for information in their 6B study?
We don't, as a matter of practice and policy, we don't comment on our engagement with those sorts of programs.
But you will comply and you will cooperate with them?
We always aim to comply with any appropriate government body.
Let me ask you something. The cyber attack, and certainly this has had an impact. I believe that there was a member of your team who was at the Doctors Caucus maybe a couple of weeks ago and made the comment that that they responded quickly to the pharmacies and got them back up and running. And I asked them to define quickly, and that was 2 weeks. Well, 2 weeks for a patient going out their medicine is an awful long time. I think we would all agree with that. Look, everyone, you, me, Democrats, Republicans, independents, we all want the same thing. We want accessible, affordable, quality health care. And accessibility is being impacted by the vertical integration that exists in the drug pricing change and in health care in general. You can see with this chart right here. You're the largest of all of them, and that's fine. I get it. I know that this is a capitalistic society. But this, to me, is a direct conflict of interest. I want to ask you one other thing. Since the start of the cyber attack, how many medical practices and pharmacies have you acquired?
We've acquired just one medical practice in Oregon.
Just one since the start of the cyber attack.
Correct, and that was agreed. The transaction was agreed before the attack.
Okay, so if we look at the records, we're going to find out that what you're saying is that you haven't acquired any during the time of the cyber attack.
So we've acquired one medical practice in Oregon, and we've added 2 IPAs to our network. As far as I'm aware, those are the only additions that have occurred. And I just want to reassure you that any valuations or assessments of those businesses are based on the economics before the attack took place. We would never try to take advantage of this.
I hope that, and I have no other reason but to believe you're telling me the truth. But at the same time, you can tell, obviously, I'm very passionate about this, and I'm very passionate about healthcare in general. I did practice for 40 years, and I want to make sure patients have accessibility, and pharmacists are the most accessible healthcare professionals in America, and we're going out of business.
And perhaps, so please let me offer, and I would genuinely like to, I've worked alongside pharmacists my whole career. I very much want to make the offer to work with you on how we can work together to strengthen retail pharmacy, particularly in the smaller pharmacists. And it's an area where at Optum we are trying to move more investment to support the smaller pharmacists who we are proud to include in our
and I
network.
appreciate your offer, but let me assure you that I'm going to continue to work to bust this up. And this vertical integration that exists in healthcare in general has got to end. Thank you, Mr. Chairman, and I yield back.
Thank you. I appreciate you yielding back. We would love to continue discussions on PBMs, but that wasn't today's hearing. But we do appreciate your openness on that. Seeing there are no further members wishing to ask questions, I would like to thank our witness again for being here today. I ask unanimous consent to insert in the record the documents included on the staff hearing documents list, which the ranking member and I have gone over. Without objection, that will be the order. Pursuant to committee rules, I remind members they have 10 business days to submit additional questions for the record, and I ask the witness to submit his response within 10 business days upon receipt of those questions. Without objection, subcommittee is adjourned.